Here we go. Hello, my name is Britta Dornan, and I'm the Executive Director of Strategic Relations here at NephCure. And welcome to Turning Adversity into Action. And thank you very much to our partners at Travere for sponsoring this session. Thank you very much. Let's give them a round of applause. Thank you. All right, so everybody here has a story. Everybody has a story that brought you here in the room today. And everybody who works at NephCure has a story that brought them to NephCure. And my story is a story of rare disease and turning adversity into action. 26 years ago almost, I was diagnosed with a rare disease, not kidney, but lymphatic. Feeling too much energy, I gotta stand. And hearing those words and reading those words, incurable and chronic, it was crushing to a 23-year-old person. But I went on with my life and I managed my disease, and it affects my legs. I can't stand up without the help of compression stockings for 24 hours. But it wasn't until 15 years after my diagnosis when one day I suffered an accident. I was actually attacked by two dogs that ripped up my legs, sent me to the ER. I'm sitting there in the ER, I'm giving you a short version here, got my compression stockings torn up in my lap, crying. And I thought to myself, I am not going to be a victim. I'm gonna be empowered. I'm gonna take back my power. And 2 weeks later, I started a blog. I reached out to my patient advocacy organization, like the NephCure for my disease, and I engaged in something we're gonna talk about today, government advocacy. 2 years later, I won the Outstanding Advocate of the Year award, and it's the most proud thing that I'm most proud of in my life. So how many here today, at some point in your life, by show of hands, have you thought, there's gotta be something I can do to help others? Raise your hand. Whether you thought it today, weeks ago, years ago, look at all these hands. Well, there is something you can do, and it is called government advocacy. As opposed to something we talk about, patient advocacy. Government advocacy is sharing your personal story, just sharing your personal story to policymakers in order to change or advance policies and legislation. So I'll say it again. It's simply sharing your personal story to policymakers in order to change policy and legislation. So today I've invited a few friends who know a lot about that. And their bios are in the program, but as I introduce them, I'm gonna share just a few details that stand out to me. And I'm gonna introduce our first guest, who's our local here on the panel, Texas State Senator Kelly Hancock. And I'm going to tell you that he represents Tarrant County, which is just a few hundred miles north of here. And he was elected in 2012 to the state Senate, but before that served a few terms in the Texas House of Representatives. But most impressively, he served 13 years on the school board. I think that's really that's God's work. You've been married for 37 years, have 3 grown children, 5 grandkids, and Senator Hancock joined us here today because in his late 20s, he was diagnosed with something that a few of you have heard of, IgA nephropathy. And so before I introduce our other guest, because the senator has very limited time with us here today, so before he has to take off, I'd like to ask him a few questions and then introduce our other panelists. So Senator, would you mind sharing a little bit about your incredible story and how you decided? I told you about my aha moment in my life with the dogs. What was your aha moment that you said, I'm gonna do something about this in my role?
Well, and let me start. We now have 6 grandkids. Our oldest had a 4-month-old when she found out that there was a Emmy. There was a little child that needed a home. Parents and grandparents were not capable of taking care of her, and so they became conservators, which 6 months will be June 17th. We'll have a hearing there. And once we get through that hearing, they'll be able to start the adoption. But Emmy's already part of our family. Beautiful, sweet little girl, and very proud of our daughter and son-in-law and special son-in-law. I had a story with him later on bringing Emmy into their home, and so she's wonderful. So now we have 6. We had 3 last year. But yeah, we were, as you heard, I was in my upper 20s, actually serving on school, about to serve on school board, and had just had a child. We had Chloe, who's the oldest one, who is the one who will be adopting Emmy. And so ready to start our family, everything going fine. I'd gone, play racquetball with the customer for work, came back. We're talking nephropathy, so went to the bathroom, and it was clear something was not good. And so began doing a lot of tests, of course, 31 years ago. Lots of tests. Long story short, ended up having a biopsy to determine that I had IgA nephropathy, which was the only way to diagnose it at that time 30 years ago. And told the same thing that anybody in this room who has IgA was told is, look, you got 2 days, 2 weeks, 2 years, and I'd made it 30 years, watching it degrade. Yeah.
Wow.
And
how did you do that?
Well, kind of a God thing that you can live with IgA nephropathy because as they told me, do your own thing. In fact, I initially taught my first nephrologist, and I was a big runner, enjoyed working out, told not to run more than 2 miles at a moderate pace. So I found a different nephrologist at UT Southwestern who was a runner, and literally said, we don't know much of anything about this disease. It's very, very rare. Do whatever you feel comfortable with. So I ended up running 6 marathons. The last one was with my daughter, the one adopting, and that was 11 years ago. So which is, in hindsight, looking back on it, I was probably down below 30% at that point. I did jump to the end. I did have a kidney transplant with my son-in-law, who is adopting Emmy. So. My son-in-law was the best match, had 8 family members, but I got down to about 8 to 10% function. I am in the legislature. Fortunately, we only meet every other year. The last 2 sessions, very difficult. I don't know if you've been to the Texas Capitol. We do not have carpet on the floors. We do not have padding. The last 2 sessions, my feet would hurt terribly, especially depending on what I would eat, which is part of the story you're going to. And so I would spend the day on the floor. Last session, telling staff, because they didn't know, because I didn't talk about it. I didn't know what was going to happen. I didn't know when I'd be on dialysis. I didn't know when I might not even make it to dialysis. I just knew I was degrading and I was being tested all the time. But with the work that I do, I just chose to keep it to myself. Everybody thought I was really, really healthy, which was really funny. Because I do work. I've always worked. I worked out all the time, and they thought I was a really good eater because the last 10 years I didn't eat any meat because as my numbers went down and I could feel my body changing, so I was very, very disciplined in my diet, and really didn't drink anything but water for years and years, and still don't. And so just kind of that helped a lot. And so as it got worse, I'd have to eliminate more foods and basically kind of a Mediterranean diet, but was able to make it, much longer than they thought. 5-6 years ago, they told me I had a year or 2 before, I needed a transplant. That's when I started, telling family members that, and I didn't know who I was being tested, but 8 of them were being tested. I made it 5 years instead of the 1 or 2, just with,
amazing.
Which is kind of amazing. It's when I look back on it, I'm like, it's crazy I was able to do what I was able to do with the disease that I had.
And then, so you ended up getting a transplant, or needing to, and,
yes.
And fortunately found a donor close to home.
Yeah, like I said, I had 8 family members test. And my son-in-law, who is he's not even a Texan really. So who would have guessed he would have been a match? He's actually from Oklahoma, and anyway, ended up being the best match, and we had that transplant, which went extremely well. We had done, prior to the transplant, because I am in the spotlight, and if you don't know this, the Senate in the state of Texas, there's 31 of us. There's 36 congressional delegates in Texas, so We actually represent about 1 million people. Is each district. So Texas is about 30 million people. So we filmed we brought in a news crew because nobody knew about it. Nobody except my family. They're the only ones that knew about what was going on. And I looked healthy. Of course, I used a lot of skin ointments because I was having some skin issues because of nephrology that nobody knew about. And we did an interview prior to the surgery because I did want to come out. And really what I wanted people to see is that for years I lived with this, but I lived a normal life and I didn't let it get the best of me in order, as a method for me to share my faith and how God allowed me to live a normal life and do all these things without going into depression or focusing on the negatives in my life. So we filmed this piece with Greg and I. We're going to release it, and then all of a sudden I got COVID. We had to postpone the surgery, actually 2 times, which I'm sure I'm not the only one there. But at this point, I can't walk. I couldn't walk, but I did sneak into ride 7 miles on a bike the day before surgery. Not on my toes, on my heels, kind of doing that. But we filmed this piece, and that was where we were able to kind of share the message of living donors and started our advocacy. And so that was the start of it. She agreed. I told her, let's wait till I don't die in surgery before we release this. She agreed to do that. And so we postponed it until I actually had surgery, so it went from June to July. The day I'm in the hospital recovering, we released onto the news, and all of a sudden, people knew. My other colleagues didn't know. The lieutenant governor didn't know. I shared with the governor. He's a good friend. Shared with him actually when I was supposed to have surgery, and I had to call him back and said, don't say anything because they just canceled my surgery and postponed it. But there's just a few people. And so that was really the first time people got to see it at that or hear me talk about it. And so it was a chance to kind of talk about it and the importance of living donors because, as anybody with kidney disease knows, there's 5 times the need for every donor available. And Texas actually does a really good job, check your license plate and educating on deceased donors. But we wanted to focus on a different avenue, and that's kind of where we ended up going.
Yeah, so talk about taking advocacy action. I mean, you're an elected official here in Texas, so you figured that you got to do something about this, right? So tell us about what you did.
Yeah, so we started with that. It gave us the opportunity. We got connected with Donate Life. It just so happens that I've been in the Senate long enough that I was the pro tem of the Senate, which means if the governor's gone, lieutenant governor's gone, which they would never do with me in charge, that I was number 3 in the state. And what it allows you to do, and what normally happens at that position, it's kind of a big pomp and circumstance and of drawing attention to the fact that you're a pro tem, which is not my style of doing things like that. And so we weren't going to do that at all. Parades and different, they'd call and go, well, we've got the bands, they can do a parade for you. We're not doing that. And so we took the opportunity to, rather than do that, it does open up the opportunity for you to raise money for your event. And so we chose to partner with Donate Life through a big event, because it normally is a big deal when you're pro tem and a lot of pomp and circumstance. We just focused around living donor recruitment and education. We partnered that with the legislation that we carried that would help market and educate the citizens of Texas on being a living donor. And we kind of put that all together, and then we had a big event. We had Granger Smith, who had lost a child and donated the organ, a 2-year-old boy, and donated the organs. So it kind of fit well, having Granger Smith come and do his concert. He was going into the ministry. This was his last summer to sing. If you never heard him, you ought to look him up. He's really good. Went to A&M. Thank you. So we partnered with him and just threw a big event out at Barton Creek and really had a good time, and staff did a wonderful job. It was really top notch, and we're able to raise, coupled with the legislation that we carried and passed, and of course, who's going to vote against a guy that just had a kidney transplant? So it passed very easily. It's hard. I didn't get much opposition on it. But we raised $200,000 to kind of kickstart and help them in their marketing campaign, and of course brought a lot of attention to it on that. But it was a great one-time event, and a lot of several phone calls and friends. Due to my connections, we were able to raise a lot of money and start a new program in the state of Texas, which allows us to lead again in pursuing living donor. And promoting it as a state, not just as an organization, but as a state.
So the law enhances education about living donors,
Correct.
How to become one.
How to become one, helps educate them about them. And we actually had my son-in-law and a gentleman from Fort Worth come in during the concert and do an interview like this and talk about being a living donor. My son-in-law, we had surgery on a Wednesday. He went home on a Thursday. I went home on a Friday. Everything went really well. And so we just kind of educated a lot of people and had a huge
Amazing.
Concert, a lot of people there, and so.
Wow, what a wonderful example of
well, it was easy for
turning
me.
Adversity into action.
I knew the elected official really well.
Let me ask you a question, because I know they're going to pull you out any minute now, and I want to give an opportunity if someone has a question, maybe two, before you go. But I wanted to ask you, when you're not an actual elected official, you can't introduce state legislation, but what if people here, they want to engage their state elected officials, and maybe to ask them about doing a similar bill in their state? What would you recommend?
So most likely you're going to talk to staff in situation, depending on your state and how big they are. I mean, 1 million constituents, I don't turn down an appointment, but that's pretty rare. In fact, I've had people come along with me and say, well, I couldn't get in. I'm like, did I refuse to meet with anybody this session? And my chief of staff will have to say, no, you met with everybody. So we're trying to work with it. It's just developing the relationship and understand that everybody's got their issue. And, in Texas, we're the 8th largest economy in the world, so there's lots of issues. And just, I would say, kindness, gentleness, assertiveness, which is different than aggressiveness, and developing that relationship, and don't recognize that staff does most of the work. And we're part-time. I get $600 a month. I run a business. It's how God's blessed our business, which is the only way I get to serve. And of course, last session we were in Austin 11 months, so I didn't do much around the business was, and so just patience, understanding, and approaching the issue humbly but yet assertively. And just stay persistent with it.
I hear. So from what I'm hearing, it's reaching out, calling up your state elected officials, get an appointment, whether it's with the staff or the person themselves, and telling your story. And
we're no
talking
different.
to them.
I mean, and that's that was the one thing, is showing people too that look, even elected officials, because everybody thought my life was just rosy, great family, great wife. We went to kindergarten together. And, I lived like it was rosy. But I wanted to show them we're all the same. As you can see, I had kidney disease too. I'm not any different than you are. I put on a suit just to impress you. It's not what I wanted to wear today on a Friday. It's literally what they had on my calendar. Business, pen, which I have a Senate pen. And I don't like seeing it on my calendar. I prefer business casual or casual. But we're not any different than you are. I still shop at the grocery store. I still fold laundry. Just recognize that when you talk to them. Now, there'll be some that will act like they're not just like you. Trust me, they're just like you. And just approach them that way.
Excellent. Thank you so much.
Thank you. And I am. You want to take some questions? Maybe
one quickie, if anyone's got one. Yes, ma'am. What's your name? Ellie. Ellie, what's your question?
Just a quick question. If we wanted to approach, our state government on something that I personally feel will probably never happen, how do you still approach it and hope that there's a chance that they could address it?
I think with that attitude is, hey, I wouldn't have that attitude. You know, I've been told legislation that I've passed, you'll never get this passed. And balanced billing used to be a big deal in the state, and I was told you'll never pass it. It took me 10 years. We passed it. So that you're not balanced billed in Texas, and you haven't been for years. So I would go on with the attitude. Let them tell you this will never happen. And then in that case, you might need to go to somebody else. But go in open-minded and just understanding. Now to say, I understand this won't happen this session or this year. I just wanted to make you aware of it. And so I think you have the right attitude on doing it, but just don't be afraid to do it.
Yeah, it's not so much being afraid to do it, it's just that, for what I'm thinking, I don't know if it's just a state thing or a United States.
Yeah, that happens a lot. I get accused of, you know, because people are a lot madder at Congress than they are at us in Texas. We're doing things pretty all right. And that gets happen a whole lot is they get confused with, and just recognize that if they say this is a federal issue, that it really is a federal issand then you have to go from there. Yep.
Thank you,
Thank
Senator.
y'all very, very much. And I'm very, very, very sorry.
And next time you can go
Blame
casual.
American
you
Airlines.
Can wear those jeans.
Yep.
You can,
Next time I'm wearing a
go.
sports coat. I see.
Yeah, please do. I'll take that. Thank you, sir. Take care. Safe travel. All right. Okay, you all got that. All righty, so let me move down closer to my friends here. So I am going to introduce and get a little closer to my other three friends here. My first friend is Mary Baliker. And Mary came here today from Wisconsin, and she's been a patient for a long time and been advocating for a long time, more than a decade, 5 years with NephCure. And she has definitely turned her adversity into action. She's a healthcare consultant, she's an inspirational speaker, and what I found really cool is that she's an author. She wrote a children's book for any of you parents out there of a patient called Maria Never Gives Up. Are you brave like me? And it helps kids to understand and process chronic disease, which I think is really cool. And it has great views on Amazon. So welcome, Mary. Thank you. And Kimberly Queen came here from Georgia. And she's a graduate of Georgia Southern University in early childhood education. And at the age of 25 was diagnosed with FSGS. It's been a long road that she'll tell you about. But she's been advocating with NephCure for about a decade, and last year she won NephCure's Advocate of the Year award. I love it. And Lisa Cimino from Massachusetts, she is the parent of a daughter with minimal change and subsequently FSGS. Diagnosed more than 2 decades ago and has been with us at NephCure for almost as long. And she's got 6 grandkids, just like the senator, and does all sorts of volunteer work and the occasional pickleball game. All right, well, welcome all of our 3 panelists here. All right, could we go down the line? I'd like you to share a little bit more about your story so that you can help us understand, okay, so when were you diagnosed? How did treatment go? You know, what was your story there? And what was your aha moment that said, I need to do something. I need to make my voice heard in advocacy? Mary, I think you might have been doing this the longest, so I'm going to pass it to you first.
Thank you so much. So I think for me, I was diagnosed when I was 9 years old. At that time, there was not treatments, and that's actually one of the reasons I got involved with NephCure, because I was looking for research. There was nothing. My parents were told I had 6 months to live. And so I got involved when I heard that NephCure was doing research. So I think a little bit about my story is not only was being diagnosed at 9, I was falling asleep on my desk. I blew up like a balloon is the best way to describe it. I went from like 80 pounds up to 105 overnight. If you put a pin in me, I probably would have blew up because I was so swollen. They didn't know what was wrong with me. I was in the hospital, finally sent me to a children's hospital, was finally diagnosed. And so, as you can guess, as we were kind of talked about how long I've been doing this, well, I can tell you, I've been doing volunteer and a variety of different things longer than I probably can remember almost, because I was so alone. I didn't know even that anybody in my school that was sick. So I think for me, I really wanted to kind of get involved and do something. And I think when we talk about an aha moment, with my disease, again, I was diagnosed at 9. When I was a teenager, I went on in-center hemodialysis. And it was at that time, I believe, when I was on in-center hemodialysis, I decided, I think, my brother came in, I was not doing well. Again, once more, they're telling that I probably wouldn't make it 6 months to a year because I was doing so poorly on dialysis. My brother comes in, says, I can't watch this anymore, I want to donate a kidney. It was at that point that I, and again, I was a teenager, and I was trying to figure out, like, what can I do? So I shared this story about what I did, and it's kind of an interesting story because I was sitting in my dialysis chair 3 times a week, 4.5 hours at a time, and for some reason I decided that we needed to honor living donors. And I don't even know what made me think that, but I guess there was a national day at that point for living donors. So I called the mayor of my city, and I got on the phone with his secretary and told them that I would like to talk to the mayor because I would like to honor living donors and deceased donors in some way on this specific day. Mind you, it was the following week. So, of course, the secretary is trying to protect him and says, well, we could make an appointment. And I said, because she said he was in a meeting and there was other things. I said, well, I got plenty of time. I have 4.5 hours. I'm on dialysis right now. And somehow I got moved right into his office. And I talked to the mayor and I explained, that I was on dialysis right now. And I said, that really doesn't have anything to do with it, but I had plenty of time to wait. And I said, I want to have something. And he said, oh. And I said, I had this idea of like a torch of some sort. And he's like, I don't think we can have a torch in City Hall. I said, well, but a fake one. And he said, we can look into that. And he said, well, when is this? I said, next Tuesday. And this was, mind you, on Wednesday. And he's like, oh, I'm not sure that we can do that. I said, what do I need to do to make it happen? So I think that's part of why I got involved. It was that aha moment. And I think one of the questions that you were asking is like, do you think that you can't get that bill passed or it won't happen? I had the idea that anything can happen. And I wasn't scared of the mayor. I was going to make it happen. And so when people tell me I can't do it or that it can't happen that quickly, I actually ask, well, how can we make it happen? And what can I do to help make that happen? And so I have found, for me personally, is that somebody tells me it can't happen, it becomes a challenge, and I make it happen.
You are my hero, Mary Baliker. I love it.
So that was my aha.
All right, Kim, could we hear from you a little bit about your journey and your moment?
So I was diagnosed at the age of 25. Just graduated college, doing what I love to do was teach. I was teaching pre-K at the time, and I had noticed a ton of swelling. And I was waking up with my eyes swollen completely shut. And let's be honest, that is terrifying for a child, terrifying for me, let alone a child. And so I saw my doctor and immediately said nephrotic syndrome because I had the high blood pressure, the swelling, and in between the time of nephrotic syndrome and let's do all these tests, I developed pneumonia, so I was hospitalized. And my doctor, the first doctor I ever had, said, I'm not coming in, it's not that important. So I saw another doctor in the hospital, and he's like, let's run all these tests, everything comes back normal, let's do a biopsy. I was diagnosed with FSGS, and he admitted, he's like, I have no idea what's going on. I've never heard of FSGS, but I have a friend who I did residency with at Emory. Let me call her, let's start a plan. He did that, and I was so thankful that he was upfront and honest about not knowing, but he was gonna figure it out. So they started me on 60 milligrams of prednisone, and as you know, 4 and 5-year-olds are very lovey and very germy, and I was diagnosed in January. By March, I had went into septic shock because strep had went through my classroom, and I had no idea I had it. So at that time, my kidneys started failing. I developed what they call a steroid myopathy. So I lost all control of my body, like all muscles. And we were just trying steroids, and nothing seemed to work. So diagnosed in January, hospitalized in March, full-time dialysis by September. So I did dialysis for 2 years. I did home hemo. My doctor was he's like, persistent, you need to do this. And luckily enough, I was able to get a kidney from my brother. He was a perfect match. But unfortunately, 24 hours after implantation, my FSGS returned. And that was devastating because you go into it thinking life is fixing to change. Everything's gonna be normal. I'm gonna be able to be 25 again, living life, go back to teaching, and that was just pulled right out from underneath me. So we started right back on prednisone, which did nothing for me. And the doctor just kind of was like, I don't know what to do. We're gonna try everything, but I don't really know where to start. Let's start with prednisone and plasmapheresis. And I didn't know, I was like, there has to be something different. There has to be something different. I don't want to be a guinea pig because when I tell you guys I've done over 400 plasmapheresis treatments, I've done rituximab, Actar gel, blood pressure medications, everything. And that was my aha moment to say, we need better research. It's not fair for me or anyone else to feel like a guinea pig, to try this and try that and hope for the best. So that was the first year of my kidney transplant was my first advocacy day.
With NephCure?
With NephCure, yep.
A whole day.
Yep, I planned it around my plasmapheresis schedule. So I did plasmapheresis, the next day I flew out, we did advocacy. I did the next day at advocacy, and then I flew home early that day and went straight to Emory and did plasmapheresis again.
Amazing. Thank you so much, Kim, for sharing that. Lisa, could you take us
So
through?
my journey with kidney disease started way back in 1999 when my daughter Brianna was 2. She's the youngest of our 4 children. And probably like most children, she woke up with swollen eyes. And of course, calling the pediatrician was told it's probably allergies. Give her a Dimetap before bed. And of course, that didn't make any difference. And within a few months, we noticed that her whole body was swollen. And at that point, her pediatrician took one look at her and said, I think I know what this is, and sent us to Boston Children's Hospital, where she was diagnosed with nephrotic syndrome. Confirmed with a biopsy later that year, minimal change nephrotic syndrome. Was put on, of course, high-dose steroids, which sent her through the roof. I mean, this kid was as calm could be, and next thing you know, she is biting people. That's how, crazy time was back then. Not really responding to the steroids. They added Cytoxin. Again, no response. Added cyclosporin. Got all hairy, swollen gums. No improvement. Lots of albumin infusions, sandwich with Lasix, just to kind of keep her, without being totally overloaded. Started Cellcept, no difference. And then finally, I think it must have been about 2003, 2004, the doctor came to us and said, well, I've heard of this new medicine they're using in Canada. It's called Prograf. We've never used it before on any child, but if you're open to it, we'll start it. So we started that, and she got into a partial remission, and we were very grateful. She had 4 wonderful years of being able to go to school and just be a regular kid. And then when she was 11 years old, we noticed some ankle swelling. And I said, oh, we need to get back to the nephrologist. And sure enough, we saw that her creatinine had started to creep up and things were going downhill. And I say within the next year, she hit end-stage renal disease. We did a 1.5 years of peritoneal dialysis in preparation for her transplant. I was going to be her living donor. I got ruled out at my pre-op, so we had her listed actively, and she waited 3 months and received a deceased donor kidney. Within 24 hours, she's spilling a lot of protein again. Thankfully, because of NephCure and our connections, we knew about some treatments, newer treatment options. Even though they're not approved, we knew that they were there, and I was able to inform her nephrologist at the time, and he went home and did research and said, yes, let's do this. So we did plasmapheresis, we did rituximab, and thankfully she's been in a remission for just about 13 years.
Wow. Yay! Thank you, Lisa. And you've been engaging in NephCure's,
Yes.
local Hill Day. And
Yeah,
in
so my
Boston.
first connection, so NephCure probably was just starting when Brianna was diagnosed, and my first involvement was with National Kidney Foundation, but once I got wind of NephCure and how specific it was for nephrotic syndrome, I immediately jumped on board, and back then we had chapter leaders in our area, and our chapter leader talked about Rare Disease Day, which I had never heard of. I didn't even know Brianna had a rare disease. But the last day of February is Rare Disease Day, and at that point, I went and spoke at our local state house in Massachusetts to raise awareness of rare disease and, of course, hopefully affect some policy changing.
Okay, thank you. So what we're going to do is I'm going to ask each of you a question about your advocacy experiences, and then we're going to talk. I'm going to share a way that everyone here can get involved in advocacy this year, and have hopefully a few minutes for questions. So I just want to also put it out there, because we've been talking really, really fast here, that when we talk about advocacy, you've heard some examples of government advocacy. You've heard an example of a state senator who introduced a bill and it got passed. There's other ways to advocate for policy and legislation. Simply writing a letter to the editor. That is an example of advocacy. If you've ever seen these things called action alerts, where, hey, sign this automated letter online that'll go directly to your member of Congress on this issue, and you fill in your address and your name, and maybe you add an extra little line about yourself, submit, it takes no time at all. That's an example of advocacy. And what actually the three of these folks who have done a lot is with actually meeting with their elected officials, and particularly members of Congress. So that's a very common form of advocacy. And so, Mary, my question to you is that these members of Congress, you're members of Congress, you're one of 600,000 constituents that they have. And believe me, day in and day out, they're having people come in and out of their office asking them for things, calling them for things. So you got a lot of competition. And here we are, rare kidney, rare kidney. So how, Mary, do you stand out in these meetings? Because I know you've done it well. You even have a nickname in Wisconsin. You want to share that with us?
So for me, and I didn't come up with the nickname. They came up with it for me. I am now the kidney girl. And I'm okay with that as long as they sign my bills. I think what has happened is that when I go into their offices, I think as we were listening to the senator, they're just like us. And I couldn't think of them any other way. And if anybody's ever done like Toastmasters and spoke in front of groups, they teach you all these different things about looking at the crowd and doing all these. So it was one of those that, okay, they're human, they're just like me, but I want them to understand some of the things that I've been through. Being diagnosed at a very young age, and what that bill. So, I mean, a prime example, I guess, is that I've been doing this for over a decade. I think, like, one of the bills, for instance, with the Living Donor Protection Act, or when we're talking about any types of things around rare disease, or we're talking about the immunosuppressive bill, I try to relate it back to a story within mind, so that, because I had actually talked to a couple of people about it, that it was important to kind of connect the story. So I'll give you an example. When I've gone to talk with my senators and representatives, one of the things that I brought up when I was talking about the Living Donor Protection Act is that I brought up that, and now it's 43 years ago since my brother donated, and he's doing wonderful, but after he donated and tried to go back to his job, he was fired. That shouldn't happen to anyone. He's a hero. He saved a life. And so I explained this, what happened to him. And, my brother kind of shrugged it off like no big deal. Again, he was very young too. He was only 4 years older than I was. But to me, it broke my heart. Like, he got fired from his job because he saved my life. So I think the big thing for me that I have learned is trying to tie that to my personal story. Whether it's the immunosuppressive bill that was out there that luckily has been passed. One of the things that I talked about is, being in college and medications. I had 80/20 health insurance right out of college, and I had medical bills like you wouldn't believe. And so I was like $40,000 worth of debt paying for my medications. So I related that story back to that. And so I think that's how I actually got the nickname. And they literally will send me, and I actually have personal stories with them. It's like, they'll all of a sudden tell me their wife's pregnant. I mean, I get pictures of their wife and their baby and things like that, or vacation pictures. So, I've built a relationship with them.
Yeah, so your personal stories, the power of the personal story, because that is memorable, and connecting it to the legislation that you're trying to advance. And
like the New Era bill,
yes,
bringing it up and talking about how that can impact us as rare kidney disease patients.
Yes, that's right. And it's what Mary's referring to is a bill that was introduced in Congress that NephCure led the advocacy efforts for, and it's called the New Era of Preventing End-Stage Kidney Disease. It is a bill in Congress, bipartisan support, and there's more about it in your program if you want to read about it in your program, but this is the bill that is the only, on page 59 of your program, is the only federal bill that addresses specifically rare kidney disease research, enhancing provider education, patient education. So to connect your story to those issues. And I'd like to build on this, Kim, because that power of building a personal connection, that can make all the difference in the world, is creating this human connection between the member that you're meeting with or their staff member. How have you done that?
So I think it was like our second or third year of advocating, and we were going into a Georgia office, and you're meeting with staffers, and they are about 20, 30 years old, and that's about the age I was. I diagnosed at 25, I'm 30, and we walk in, we're sitting down and talking to a girl from Georgia, and we were telling the story, and she's like, "You look familiar." Come to find out, she was a year older than me, and we went to the same high school. So we're sitting there in Washington, D.C., and I'm able to tell her my story. And probably would never talk to her on a normal basis. Like, we weren't really friends. We just went to the same high school. But it's just crazy how small things are. But then because we had a relationship of being in the same area, it was pretty impactful for her, and especially her being the same age as me. When I told her, I was diagnosed at 25, my life changed completely. She's like, "Whoa, hold on." Like, it takes them a step back because they're like, "This could happen to me." What do you mean? It can just come out of the middle of nowhere, because it did, And I think people don't realize that, and you have to tell your story, and I think people get nervous telling their story, but you have to remember you're the expert in your story. No one else can tell your story like you can, and most of these staffers or these congressmen or women, they have no idea. So you're telling them, and you're educating them, and you telling your story is so powerful. Like, I was actually with Lisa one year. We were in a Massachusetts office, and it was the year I actually was getting ready to have a hip replacement because of prednisone use. And we were talking, and he actually knew about FSGS, and most of the staffers don't. So we were having this conversation with him and telling him our stories, and he was asking questions, wanted to know more. And you'll have those staffers who will ask questions and engage, and, "Well, what was your treatment? What were you doing? How did this affect your life?" And then you'll have some that be like, "Okay, I'll pass it on." But those ones that really engage with you, tell your story, tell them everything, answer every question. Because when you go back, if they're still there, they're gonna remember you and ask you, "How are you doing? How's things going? How's the treatment?" And so just being able to truly tell your story, every bit of it, even if you cry, because trust me, I have many a times, but it's impactful.
Excellent. Thank you very much, Kim. Now, Lisa. Lisa is, of course, the parent of a patient. So advocating as you're not actually the patient, that brings a different dynamic to it, because you're not just sharing your story, you're sharing someone else's story. So tell us, does Brianna advocate with you?
Correct. And yes, she has gone to Hill Day twice. And she's a introverted, quiet person. She actually had selective mutism as a child, which means you don't speak outside of your house. So for her to go to Hill Day with me as a teenager was a pretty big deal. But she came. NephCure is wonderful at preparing you for what it's going to be like. And she was able to sit down, and you're at the small conference table in the office, and she was actually able to talk about her story. And oftentimes when Brianna's talking about what she's been through, she will cry. But you know what? I think that's okay. You know, I think it's important for people to realize how challenging life is with these rare kidney diseases.
How old was Brianna the 2 times that she participated?
She was early, so she was probably 12 and then 14.
So did you have conversations with her beforehand? Did you sit her down and,
Yes.
and take her through what to
Yes.
expect?
Yes, and I actually, I gave her the option. I encouraged her to come. We've always encouraged her to participate as much as she can. She struggles with fatigue still. So she would go and she would do as much as she can. But yeah, just letting her know just to speak from her heart and to speak about what she can remember. And now she's a 27-year-old, and she'll often say to me, "Mom, I don't remember a lot of this." And I'm like, I know, and I have to remind her of what she's been through. So it is sometimes good to forget what you've been through, but also to know, this has happened to you. It's part of you.
Wow. Well, we'd love to have Brianna come back to Hill Day. And
I will let her know with her new husband.
Oh, exciting. And so we've been saying this term Hill Day, and what the heck is that? And so every year, NephCure hosts what you would call a lobby day, and it's called Rare Kidneys on the Hill Day. And this year, it's on July 24th and 25th. And in your program on page 60 is information about this event. And this is how it works. You travel in on that Thursday, the July 24th. You come join us for dinner in a room like this, and it's called a rally dinner because we kind of get all psyched up. We have a good meal together and tell some stories and just kind of remind ourselves about, okay, what's that bill? And you kind of huddle with the teams of people that you've been assigned to, because you get assigned to a team of people who are from your state, or if there's not that many of you from that particular state, you might be paired up with people from a neighboring state. And then the next day, it's a long day. It can be a pretty 10,000 step type of day, and we schedule. NephCure does the work of scheduling these meetings, and so you meet with your House of Representative member, and you tell your story, and you ask them to whatever it is that you want them to do, whether it's supporting the New Era bill or research money or whatever. And you meet with your U.S. Senator and perhaps the members of Congress from other states. You kind of support the other people on your team. And then we come back together in the evening for a reception on Capitol Hill still. It's all on Capitol Hill. You see these places on the news a lot. That's where you would be. And we come together and kind of decompress and share some stories. And then you've made some friends for life. And hopefully some of those friends are these members of Congress or their staff. And so I'd like to, first of all, make sure that you all know this gentleman sitting here right in front of me, Matt Johnson, if you wouldn't mind, come on, stand up, come on, all right, take a bow. Matt Johnson, everybody. He's our Director of Government Relations and Advocacy, and he is running point for this event this year, and he would love it if each and every one of you in this room were to join us. And there is a page on our website where you do a quick registration. We have many scholarships available. That means we pay for your flight. We pay for your hotel. So the sooner you apply for that, the better. If you're interested, if you have questions, please talk to us. And so what I would like to ask each of you, because you've all done it at least once, multiple times, I'm sure, you've participated in this NephCure Rare Kidneys on the Hill Day. Can we go down the line and share with everyone here why you think they should do it or consider it?
So I think it can be really rewarding, I think, to go to Capitol Hill, and even at state level. But I think when you're at Capitol Hill, I mean, I think as people were mentioning about crying, it's quite amazing how all of a sudden you'll get all these emotions that kind of come up. And it's like, how did that happen? I mean, I've talked about it, and I've been doing this a long time, but I still get really emotional. And I think for me, when I actually see a bill getting passed that I have been working on and sending messages. I mean, one of the things that I do, and that's why I become the kidney girl, is because I'm a pest. I don't, they've met me once, and then I'm sending a thank you note. And then there's like, I don't know, it's Donate Life, so I'll send them a, flyer about that. Or it's rare kidney disease, I'll send them something about that. I'm constantly sending them something. So they've kind of gotten used to, how many people are waiting for transplant, how many people are on dialysis. I'm constantly, and we need more funding. So I don't leave them alone. And I think so for me, seeing it, it's not going to happen unless we use our voices. We're rare disease. If they don't know about it, they can't do anything about it. So I have learned that using my voice, telling my story, it can work. And so we need more often, and we need to be out there constant. And, I would love to see all of you become kidney guys and women, because it's pretty amazing. I mean, literally I'll get, oh yeah, it's the kidney. I mean, they literally laugh. I mean, and I didn't make it one time recently to an event, and I actually got a message about 3 weeks after from the lead policy person wanting to know if I was okay. Because they did not know why I was not there. So it's just that building that relationship, but then actually when those bills get passed, you are a part of making history.
Yeah. Thank you, Mary. Kim?
Hill Day is just such a great experience. Not only are you getting to make a change, but you're also getting that time to make patient connections too. Like, you are getting to meet new people. Like, I met Lisa at Hill Day, and we talk all the time, and it's always that, let's catch back up. And I met a lot of people at Hill Day, so there's that great connection. And NephCure does such a good job at preparing us for this experience. Like, you go in at that rally, and they tell you what to expect. They give you a packet. And I know government stuff can be overwhelming. Bills can be overwhelming, but NephCure lays it all out for you. They give you the information to pass along, so all you really have to do is tell your story, maybe bring up a name, pass them a thing, and it's so amazing to tell your story. And sometimes I feel like I did something, I made a change, and if we don't tell our stories, no one's gonna know. And the more people who tell their stories, the more people who know, and all it's going to take is one person, and that one person can be that change for every one of us.
God, we better be recording this. Lisa.
I would ditto what Mary and Kimberly had to say, and just add that for me, it's pretty special being in our nation's capital and understanding. I had no idea really much about our government and what it would take to get a bill passed, and that you want different congressmen or senators to sponsor a bill. The more you can get on board, the better chance it is as they bring it to the floor. And I just found it very empowering and very exciting to be there and to know that perhaps this small little bit that we're doing could have a big impact on people's lives.
Thank you, Lisa. We've almost made it to the end of the day here. Does anyone have any questions? We've covered a lot of information. Feel free to raise your hand if you've got any questions. And otherwise, you can ask questions about Hill Day to me and Matt, or talk to our panelists afterwards. Yes, Michael.
That's all right. So I asked this question the last few years. So first a comment. Thank you very much for the three of you for having the bravery to sit in front of us and telling your story. morning, and I said the way we're going to find a cure together as a team, teamwork makes the dream work. By you telling your stories to all of us, you're bringing awareness and exposure to the foundation and to the disease, and that's how we're going to find a cure. So along those lines, I'd just like to ask the three of you a two-part question, simple. How did you find NephCure, and what has NephCure meant to you?
So when I was diagnosed, my mom was the Google queen. She searched everything and she found NephCure. And when I was diagnosed, like I was in the hospital, I had no involvement, honestly. Like my mom was constantly involved, finding all the information. I've become more involved as I've gotten healthier and had a new transplant. NephCure, it's family, it's hope, it's coming into a room like this and not having to explain every little thing to everybody. Because in my daily life, when I explain, like, why am I taking this medication, or why do I have to worry about this, I have to explain it every time. And sometimes it gets overwhelming, and you're like, I just don't want to do this right now. Like, you have your moments where I'm like, okay, I don't want to explain why I'm taking prednisone and why I'm taking this. So to come into a room like this and explain why I'm taking this, and I've tried this, and somebody just gets it. You don't have to sit there and explain. And so it's just, NephCure has been a life-changing for me. It really has.
And I think NephCure found me. I think NephCure was seeking patients back in the early days. And I can remember them sending me a huge box filled with materials to be a chapter leader. And I had 4 kids, and Brianna was newly diagnosed, and I knew I couldn't do it. But I held on to that information, and I remember the smallest thing I could do was collect old cell phones, because they had these boxes that you could put, and I put one in my dad's barbershop, and we would send them off to NephCure, and NephCure would get some money. I mean, that's how simple it was back in the day. And then our relationship just grew as NephCure grew.
So I'm embarrassed to say that I felt like I knew a lot of the organizations that were out there. My background is public health. I worked in healthcare all my life. And it wasn't until, probably 5-6 years ago, I was at Kidney Week in San Diego. And there was somebody that I was on the patient advisory committee with the Kidney Health Initiative. And we were at dinner and we were chatting, and he asked me what type of disease I actually had. And I told him, and he goes, so are you involved with NephCure? I'm like, who's NephCure? And he started telling me, and I'm like, okay, put me in touch with them. What do I need to do? Because, again, as I kind of started out, my background's clinical research, and I'm very embarrassed that I did not know about NephCure. And so I dove in head first and said, I am going to work with NephCure. I want to help them. I want to make sure we get the clinical trials out there. We need to find a cure. And so it was kind of by luck that I was having dinner with somebody that was involved with NephCure and found out, based on my rare disease, that he felt like I should be involved. And I've been involved ever since. And again, it's family.
Well, I happen to think it's not luck. I think it's meant to be. And I thank God that for the Google Queen, for that dinner, and for us finding you, Lisa, because as I shared with you, it's been almost 11 years since I decided to take my power back and engage in advocacy, but which made me very proud, but I'm even prouder to advocate alongside all of you. All right, so I'd like to thank you all, and thank you all especially. And let's invite our Executive Vice President, Lauren Eva, to the stage to close us out.
Let's give one more round of applause to all of our speakers today. Thanks, everybody. Thank you for this wonderful panel and for sharing your stories. And thank you to all of the healthcare professionals, our experts, the patients who've shared stories today on panels, and all of our stakeholders, our industry sponsors who've helped make this possible. So thanks, everybody, for making this a really great first day of Summit.